Nobody wants to spend their vacation sick in a hotel room. But according to doctors, traveling dramatically increases your risk of respiratory infections, stomach bugs, food poisoning, dehydration, and even blood clots. So what do medical experts actually do to protect themselves when they travel? A new report from HuffPost interviewed doctors about the habits they personally follow to avoid getting sick while flying and traveling. And some of their answers may surprise you. One of the biggest mistakes travelers make: not sleeping enough before a trip. Doctors say sleep deprivation weakens the immune system and makes people more vulnerable to infections. And travel itself already stresses the body. Crowded airports, time zone changes, dehydration, poor eating habits, and exposure to thousands of people. Many doctors interviewed said they prioritize sleep before travel just as seriously as packing luggage. Some even avoid early morning flights specifically to protect their sleep schedule. Because once your immune system is weakened, exposure during travel becomes much riskier. Even years after COVID, many doctors still wear masks while traveling, especially in airports, boarding lines, crowded terminals, and airplanes. Not because planes themselves are uniquely dirty, but because travel puts huge numbers of people into close proximity for hours at a time. Doctors interviewed by HuffPost said high-quality masks, like N95s, still significantly reduce exposure to respiratory viruses. And many physicians say they especially mask during flu season, winter travel, or if they notice people coughing nearby. Some also wipe down tray tables, armrests, and seatbelt buckles, which studies have shown can contain bacteria and viruses. Another thing doctors consistently mentioned: hydration. Airplane cabins are extremely dry environments. Low humidity can dry out the nose and throat, irritate airways, worsen fatigue, and potentially reduce some natural protective barriers against infection. Doctors say many travelers unintentionally become dehydrated because they drink alcohol, consume too much caffeine, or avoid water to reduce bathroom trips. Some doctors specifically bring electrolyte packets, reusable water bottles, or hydration tablets while flying, and they recommend drinking water consistently before, during, and after flights. Food poisoning is one of the most common travel-related illnesses worldwide, and doctors say they're often cautious about buffets, undercooked foods, street food in certain regions, raw seafood, and food left sitting out too long. That doesn't mean avoiding all local food, but many physicians follow one key rule: if something looks questionable, don't risk it. Doctors also emphasized hand hygiene before eating, especially in airports and transit hubs, where thousands of people touch shared surfaces every day. Some carry hand sanitizer, disinfecting wipes, and even their own snacks during long flights. One major travel risk many people forget about: blood clots. Long flights can increase the risk of deep vein thrombosis, also known as DVT. That happens when blood pools in the legs during long periods of sitting. Doctors interviewed said they frequently stand up during flights, stretch, walk the aisle, and flex their calf muscles regularly. Some even wear compression socks on long international flights. The risk is especially important for older travelers, smokers, pregnant passengers, or people with prior clotting conditions. Even simple movement every hour can make a difference. Travel can be surprisingly stressful. Flight delays, crowded airports, lost luggage, poor sleep. Doctors say chronic stress weakens the immune system and makes illness more likely. Some physicians intentionally build buffer time into travel plans to reduce anxiety and rushing. Others avoid overpacking itineraries so the trip itself doesn't become exhausting. One doctor told HuffPost that managing stress is just as important as avoiding germs. Because health isn't only about viruses, it's also about how the body handles strain. Another common theme: doctors stay up to date on vaccines before international travel. Depending on the destination, this may include flu vaccines, COVID boosters, hepatitis vaccines, typhoid vaccines, or region-specific immunizations. The World Health Organization and the Centers for Disease Control and Prevention both publish travel health guidance for specific countries. Doctors also recommend checking travel advisories before leaving, especially during outbreaks of measles, dengue fever, malaria, or foodborne illness. The biggest takeaway from all of this? Doctors don't rely on one magical trick to stay healthy while traveling. Instead, they stack multiple small habits together: sleep, hydration, hygiene, movement, stress reduction, and smart precautions. None of these completely eliminate risk, but together, they can dramatically reduce the chances of your trip turning into a medical nightmare. And in a world where travel spreads illnesses faster than ever before, those habits matter more than many people realize. Subscribe for more global health and medical stories, and let me know in the comments, what's your best trick for avoiding getting sick while traveling?